Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me.
Yes, sir. I just wanted to begin with the close off yesterday, Thursday. What were our figures?
Well, in terms of vaccination, we have now had about 163,534 persons who have received their first dose of the vaccine, which would be approximately 33.6% of our adult population. We've also been able to administer 21,203 second dose, and so that now takes us up to about 4.4% of our adult population now being fully immunized.
All right. I'm noting the numbers, and I'm seeing that a lot of people are taking the second dose, which is a good thing, and what you've been calling for.
Well, we want to encourage everyone who got their first dose to come back and get their second dose. And as you would realize, because with the AstraZeneca vaccines that we had given out initially, it takes about 12 weeks for someone to come back for their second dose. And so quite a few of them are now falling due, and we want to make that special appeal to ensure that everyone who got their first dose, especially with the AstraZeneca, to come back and get their second dose. We also know that for those who received their Sputnik V or Sinopharm vaccines, by now the second dose would have fallen due as well. And we want to encourage them to check their vaccination cards to make sure that they know the date when they have to come back and get their second dose, because for those two vaccines, it's a shorter time frame, it's 4 weeks, and we want to make sure that people get their second dose within that time frame, because that's when the vaccine would be able to work optimally.
All right. As we're on the topic of vaccines, I know we're to receive some more Sputnik V. Could you give us any particular information on it?
Yes, we're expecting to get 68,000 doses of Sputnik V, and we should be getting them shortly. So that would be both first and second dose of the vaccine, because with Sputnik V, it's two different types of vaccine. Those that you get for your first dose is a different vaccine, and those that you get for your second dose is a different one. So it's not like the others that we've been giving, where you use the same vaccine for first and second dose. In this case, we're using two different vaccines.
All right, thank you, sir. You had mentioned in the week that there will be several outreaches as of this weekend, and we know that that would be basically for awareness and to ramp up vaccination. So with respect to Region 4, I wanted to clarify, will the fixed sites that we have remain open throughout for Saturday?
Several of those sites would remain open, plus we will do some mobile sites, but all of this would be published, and I'm sure if you go to our Facebook page or website, you would be able to find that information, not just for Region 4, but for all the regions.
All right. I had read in the news yesterday that Gaisuku had sort of a bit of a scare when some of their employees had tested positive, and they eventually worked along with the Ministry of Health, and they were able to deal with that. I know this is the sort of initiative that you've been advocating for, working with private entities. Could you just briefly guide us on how companies can contact the ministry and get all that sorted out?
Well, it's very simple actually, because we do have in every region, we have an RHO, a regional health officer, and in each of those regions they also have a regional COVID task force. So in whichever region you're operating in, what you need to do is to contact either the regional health officer or anyone from the regional task force, and they would be able to guide you in terms of who to speak with and so forth. If you talk to the regional health officer, they would be able to make those arrangements quite quickly for whichever company. We do, if someone has been exposed, there's a process to be followed because we want to quarantine that person to prevent further spread, and eventually we'll test them. So if they test positive, then we'll have to isolate and to get all that person's contacts so that we can reduce the spread of the infection. So this has been going on, and each one of those regional teams by now would have very good experience in managing these things. And we continue to use the two options that are available to us. That is, if you are positive, you can use the option of isolating at home or in one of our institutional isolation facilities. If you're exposed and we keep you in quarantine, there are the two options as well. You can quarantine at home or quarantine in one of our facilities. And this is in any one of the regions. So these options are available to people. But we continue to monitor across the country. As you know, over the last 24 hours or so, we would have had 147 persons who tested positive. And currently, we are monitoring 1,866 active cases in all the regions of our country. Of those, we have 83 persons who are right now in hospitals. And in the different regions, we have seen a number of places that we deemed as hotspots. So if we look at Region 3, for example, Tushin area is still considered to be a hotspot. We have currently 31 cases there. In Parfait Harmony, we have 24 cases. In Vredenhoek, 21 cases. In Canal number 2, there are 17 cases in that area. When we come to Region 4, where we have our highest number of active cases, we have seen that on the East Bank corridor, that you have 46 cases at Diamond. Grove, we have about 30 active cases. Herstelling, 28 cases. So you have a very active area, so to speak, in between Diamond, Grove, Herstelling area. And so we have to put in some more interventions and try to reduce the spread in these areas, because over the last couple of weeks we have seen a consistent amount of cases coming from these areas. In Georgetown, again, we are monitoring Sophia with about 25 cases, active cases right now. Kitty with 18, Le Penitent 17. So these are the more active areas in Georgetown. On the East Coast, we continue to monitor the Montrepose area, Nomprel. Montrepose right now, we have 16 cases. Nomprel, we have about 15 cases. Region 6, we have seen a spike in cases in New Amsterdam, and we now have 77 cases in New Amsterdam. And at Skeldon, we have seen an increase in cases there as well, with 30 cases in Skeldon. Region 7, Bartica, continues to have a lot of cases, and currently we are monitoring 81 persons who are positive in Bartica. In Region 9, we have 2 sites where we have a number of cases, Guns with 31 cases and Parabara with 31 cases. And in Region 10, we also have 47 cases in Amelia's ward, and we have 44 cases in Wisma. So we have been actively monitoring, and the regional teams are the ones who would do the monitoring, do the testing, making sure that people are isolated. And most of these cases are mild. Those who require hospitalization, as I've said, we have 83 persons right now who are in hospital. 54 of those are at the Ocean View Hospital, and we have about 9 patients at West Demerara, 4 at Maikoni, 5 in New Amsterdam, 3 in Bartica, 2 in Madia, and 6 in Linden. So we continue to monitor them. These patients, some of them would require some amount of respiratory support, and once they're stable and we monitor them and they're stable, we'll be able to discharge them in a couple of days.
All right. I know with respect to Region 10 specifically, you've had a bit of a challenge, an ongoing challenge. The other regions that are showing signs, and the reason I'm coming to this is because I know a recent announcement was made by the CDC in the US and about persons who've taken both vaccines that they can, first and second dose, I mean, that they can not wear a mask. But just to reemphasize that that does not relate to us here in Ghana and that we still have regulations that dictate that you must wear. With these regions that are showing signs of increases, I just wanted you to talk about that a little bit as to why some of them are seeing increases now.
Well, again, if people are not abiding by the simple rules that we have put out, and that is to wear face masks, keep distancing, and so forth, we are going to have spread. And once people relax those rules, and if they're with friends and they're in a familiar company, they don't know who is positive. And therefore, if they relax these rules, they're not taking the precautions, then they're going to get exposed and ultimately they're going to get sick. And some of this is what we're observing because many of these places that I have mentioned, we know sometimes people are not abiding by these rules, and we continue to use Operation COVID Curb to try to encourage people to be more careful. But a lot of this, we have to get people to take on personal responsibility. It can't be by now that you don't understand the need for a mask. Everyone, we have been talking for the last 8 months or so about the need for masking and how that protects you. So I doubt whether there's anybody who can claim they don't understand how mask works and how it would protect you. So that's something that we have to keep re-emphasizing, but not just try to educate people, is try to get them to change their behavior. Because we have seen persons who should know better, but still are not practicing what they know. And that's the big difficulty. You have to practice what you know constantly and do it the right way, because sometimes we see people wearing their mask in all kinds of weird ways, you know, below their nose, below their chin, and I'm not sure how that is going to protect them from anything. So we have to continue to encourage people to do these things, and at the same time, we have to encourage people to get vaccinated, because vaccination is one sure way in which we can reduce the burden of infections and prevent hospitalization and prevent people from dying from COVID. So we have to encourage people to do that. Now, regarding your question pertaining to what obtains in the United States and what happens here, I know a lot of people are connected with friends and family in the United States, and of course, they are getting that information from those sources in addition to what they're seeing on television or on the internet. But we have, and every country has to, look at its own epidemiological situation. We can become like the United States if we take our vaccines, because one of the things that President Biden did was to ensure that there were lots of vaccines available and had a massive vaccine rollout program. And so a lot of people in the United States now would have received their vaccines, and many of them are fully immunized, meaning that they've gotten both doses of their vaccines. I think there are more than 230 million persons who probably would have received their vaccines already. So their situation is much more different from ours. If everybody come forward and get their vaccines, then we will also be in that position where we can relax some of the things like masking and social distancing and so forth. But until we are able to achieve that level of vaccination, we would not be able to remove these protocols. So if you want to stop wearing masks, then encourage everyone you know to come and get the vaccine. And the faster we immunize the population, then the faster we can return to normalcy. So that's the simple message.
All right, Minister Anthony, thank you so much for speaking with us. Well, that's it for today's COVID-19 update. Of course, we just spoke to the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.